Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Stephen Newmark, Chief of Policy at the Global Healthy Living Foundation.
And I'm Zoe Rothblatt, Director of Community Outreach at GHLF.
Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life.
And today we're joined by Ron Howrigon, who is President and CEO of Fulcrum Strategies with 18 years of experience in the managed care industry. As a negotiator and network manager, he has held senior management level positions with 3 of the largest managed care companies in the country, and he's also the host of the Flatlining podcast.
Great. I'm excited to have a listen.
Welcome to the Health Advocates, Ron. Why don't you kick us off by introducing yourself?
Great. Well, first of all, thanks for having me. My name is Ron Howrigon. I'm the president of a consulting firm that I founded and own called Fulcrum Strategies, and we try to help doctors navigate what is a very difficult insurance environment right now. And I really appreciate what you guys are doing and glad to be here.
Awesome. So can you tell us a little bit more about that career path and what motivated you to start this consulting firm and, where you were previously with insurance companies?
I tell people I'm a recovering managed care executive. I feel like I need to do that. I've been clean and sober for 20 years now. So I started my career actually working for insurance companies, worked for Blue Cross Plan, Kaiser Permanente, Cigna, all over the country. And my job, simply put, was to try to purchase healthcare at the absolute lowest price possible. I negotiated rates and reimbursement policies against physicians and hospitals. And I started to get a little disillusioned with who I was working for, what I was doing to the practice of medicine. And when my second child was born, I was working for a Blue Cross plan. We had reduced the reimbursement for the obstetricians across the state about 6 weeks prior to that delivery and had an emergency C-section. I'm holding a beautiful baby boy, thanking everybody and everything in the room. I think I thanked the surgical tray. And the doctors did what they do. They didn't take a victory lap. They didn't take a bow. They just sort of played it off and said, hey, glad everything worked out. And the obstetrician turned right before he left the OR and said, Ron, the next time you take money out of a doctor's pocket, you remember tonight because I'm the one who was here. And I felt terrible. And later, I've heard somebody describe that feeling of being in a job that you're not comfortable with, as a friend of mine once described his job and said, I feel like a prostitute sitting on the side of the bed, counting her money, hating what I had to do to get it. And that really describes the feeling. So that's when I decided that I couldn't do it anymore. And I started my company and switched sides and decided to devote the rest of my career to try to help physicians. And that was 20 years ago now.
Yeah, a little different, but I have my own patient journey. I live with arthritis and Crohn's, and that experience with the healthcare system definitely informed me wanting to go into public health and advocate for others. So while I didn't have that I've been working on the other side feeling that you did, I definitely understand that motivation once it hits you personally.
Exactly. You know exactly what I'm talking about then.
And then, transitioning to today, so you founded your consulting firm and you help doctors fill in the blank for us.
Well, the bulk of what we do is try to help doctors negotiate fair and equitable reimbursement and contractual terms with the payers. What we tell doctors is we try to help them with the business side of it so they can focus on what they do well, which is being a doctor. Now, because all of our interactions are revolving their relationship with insurance companies, we get involved in a lot of other stuff. The frustrations over prior authorization, the frustration over denials. How can I communicate better with the insurance company, explain what I'm doing? Why are they doing this? So I get a lot of interaction with physicians just dealing with their sense of burnout, their frustration, their really dim out view of the future, which is concerning for me as a potential future patient. It was a survey that came out the other day, and it was just disturbing to me that almost 2/3 of all the physicians interviewed or surveyed said they would not recommend medicine as a profession for their children. That's really telling when 2/3 of the doctors who are caring for our patients today say, don't do this to their kids. And that's something I think we need to address.
And you attribute a lot of that to the burnout of battling with insurance companies?
Yeah, it's the financial pressures. Medicare doesn't help that as they keep cutting doctor reimbursement. But the bulk of it is the insurance companies. I had one doctor say to me, which was really telling, he said, when I went into medicine, I thought the medicine was going to be the hard part. And he was talking about sort of keeping up with clinical advancements, new technologies, et cetera. He thought that was going to be the hard part. And the hard part for him was trying to figure out how can I care for my patients the way I think they they need it, deserve it, and that I want to, with all these barriers and roadblocks that the insurance companies put in front of me. I think it's very frustrating for them. So to me, that's the biggest factor to physician burnout.
So aside, I mean, you mentioned prior authorization. That must come up a lot. That comes up a lot in our patient community. What are some of the other common issues that you encounter when talking with physicians?
So the whole process of prior auth is big. The other part of it is the physician having the patient come back in after a retro denial. They got prior authorization, they provided a service, the service was rendered, and then after the fact, the payer denies it and looks back and says, well, I don't think it was medically necessary. And now the physician has this awkward situation with their patient of, do I, as the physician, just eat that bill? What if it's for an expensive drug or an infusion that I've already provided and paid for? I don't want to bill the patient. They shouldn't have to deal with this. And so that post-payment denial stuff also gets very frustrating. A lot of physicians also get very frustrated with patients who believe they have good insurance and then realize that, between deductibles and coinsurance, et cetera, that they don't have the financial resources to really pay 20% of what is a large bill or pay the first $5,000 of the deductible. That's very frustrating for physicians to go, look, I know what you need. Unfortunately, you can't afford that. Now, how do we provide you what care you can afford, which is in many cases what they think is substandard care?
Totally. I feel like I say this almost on every episode, but it's like you're chronically paying for a chronic disease. Like our community lives with, different types of autoimmune diseases, and those don't go away. You may go into remission, but you're still going to be taking that medication for life, which means you're paying those copays for life, and it's extremely expensive.
And those are the people who need health insurance most. The young, healthy 25-year-old that goes to the doctor once a year, it's not that bad for them. Those chronically ill people are the ones who need the insurance the most, and they're the ones who have the worst time of it, both through the prior auth and all of the different bills and having a deductible reset every year. You start all over again after you paid it the last time. It can be crushing.
Exactly. Okay, so you have these scenarios where your insurance is getting in the way of the doctor-patient relationship. What do you do? Like, how do you come in and help negotiate?
So sometimes we will help try to educate the physician about what the best avenue to try to advocate for their patient is. Sometimes it's being a listening ear when they say, I'm frustrated with this. And I say, yeah, I understand. That's the nature of the industry right now. Explaining to them how to educate their patients for their rights. A lot of patients don't know that they have certain rights to appeal things, to complain to the Department of Insurance, to complain to their employer, and just trying to help them understand how to get that voice out there. I had a recent situation in North Carolina with rheumatology where one of the payers, and it really wasn't the payer's fault, the reimbursement for one of the drugs they used was well below cost. And it had to do with, the government hadn't set the reimbursement correctly. And so I helped the rheumatologists sort of draft letters to the payers to explain to them what was going on and how they could address it. And they eventually did, which is great. But it's just helping them understand how to navigate those waters.
That's great. Yeah, I think it's like until you do it once, you don't really know how to draft these letters or who to send it to. And it can seem really like vague and confusing. And then it's like helpful to have mentor someone like you, especially because I'm sure like some of the keywords that insurance is looking for based on your background to navigate that system, right?
Exactly.
I guess like on that note, is it ever like, I know exactly what they're doing because I've been on the other side of this? Are you ever kind of smirking to yourself like you have the answer?
I know their motivation and I know why they're doing things. I recently wrote an article for a Substack area and it sort of the title was Don't Hate the Player, Hate the Game. And it sort of explained that, look, health insurance companies, especially the for-profit companies, in some respects, they're doing what they should do. They're trying to maximize their shareholders' investment. They're trying to make as much profit as possible. When we invest in our retirement accounts, we want those things to happen. The problem is that drive for profit, which every company does, is counter to what the patients need. So I understand their motivations. I understand why they're doing it. I understand all of their tactics. It's then trying to help those physicians so they can help their patients counter those tactics because there's a real disconnect between what the payers want and what the patient needs.
And do you think something like a universal health plan could help break down some of these incentives that the insurance company has?
It could, yeah. It depends on how it's done. Whenever somebody talks to me, let's say about Medicare for All or something like that, I say it's a tool. If done well, it could do wonderful things. If done poorly, it can do horrible things. It's like people talk about guns are just a tool in the hands of somebody trained to use them, can be a useful tool in the hands of a child, can be very dangerous. Universal health care could get rid of the profit motivation of insurance companies, which is one of the things that creates real harm. It could create other problems depending on how it's done, but you could absolutely get rid of that profit motivation.
So, chronic disease is, I guess, becoming more popular for a multitude of reasons. And our community lives with chronic disease. So, I'm curious to ask you, like, how have you seen the healthcare landscape change over the years when it comes to chronic disease and dealing with these insurance coverage issues?
So there's a couple of things that I think have really changed. One is, and this has been true for a long time, is the insurance companies understand that a very small part of their population consumes most of the cost. It's a really bizarre kind of environment. 5% of the people in this country consume half of all the healthcare dollars. And the bulk of the people in that 5% are chronically ill. It's MS, it's RA, it's Parkinson's, it's things that are chronically ill. It's not the episodic, I had an ACL repair. So the insurance companies know that, and they don't like those patients because they're never going to make money on those patients. So they would like to attract the other 95% of the population and get rid of the 5% are chronically ill. That creates a problem. The other is, and this has been a good and bad thing, some of the treatment availability for those chronically ill has been wonderful advancements. When you talk about things like RA and MS, et cetera, some of the new therapies that we have really helped people's quality of life, but they've also increased the cost.
Totally. Yeah. Just to pause there and put things in perspective, I take a biologic for my diseases, and I always see the price. I think I pay $5 between insurance and copay assistance, but I always look at the price and it's about $6,000 per month. And who can afford that?
And so that creates a heightened awareness to those chronically ill. And given the incentive that the insurance company doesn't want those people, they don't want to have to pay for that. It creates more. That's why we've seen more of the step therapy, the prior auth, to try to get rid of that. Health insurance is a bizarre industry because when you think about it, health insurance companies finance your healthcare. That's what they don't really provide healthcare any more than my bank built my house. They financed it, but they don't want you to use the product. So it'd be similar like if you went into a bank and said, hey, I want to buy a house, I need a loan. Most of the time the bank is like, that's great, we're happy because they make money when they write more loans. When the insurance company is, it's the opposite. When you have to spend that $6,000 every month for your biologic, but the insurance company is saying, we don't want you to do that. We'd really not even like you as a customer. We'd be happy if you'd go to somebody else. That's where it creates that sort of perverse incentive. The bank wants to help you borrow money because that's how they make money. The insurance company wants to keep you from using the product because that's how they lose money. And it just creates a real problem.
And I guess talk to us about when these utilization management methods like step therapy started popping up.
Well, they started popping up, and it's been sort of an increase in use over time. Okay, they've been around for a long time. They're just getting heightened. They're getting better and better from the payer perspective. The use of computer algorithms and AI has improved that, their ability to sort of target these things. So they've been going on for some time, and as the expense of some of these chronically ill goes up, they just turn up the heat because from the payer's perspective, there's a massive amount of money to be made by either reducing the care that gets received by the patients, reducing the cost of it, or frustrating you so much that you go to one of their competitors. Think about it. We buy computers, Apple, we're an Apple shop, et cetera. So when I go to the Apple store with my corporate account, they're happy. They want me to buy more computers. If Apple has a hard time with service with me and I threaten to go start buying PC, they're going to want to keep me as a customer. I'll take you as an example because you've talked about your own biologics, et cetera. If you threaten your insurance company to say, look, if you don't provide me better service, I'm going to leave your insurance and I'm going to go to one of your competitors, they would thank you because they don't get enough premium to cover your expense. And so you'd be doing them a good thing. That's such a bizarre thing. And so that's why these efforts have stepped up. It's not just to reduce the cost. It's to kind of frustrate. The other thing that happens, which is really weird, is you don't want to be known as the insurance company that's the easiest one to deal with to get these medications or biologics. Because then in communities like yours, it would go, hey, choose Cigna or choose Aetna. I can get everything I need. It's easy. It's low. Then people will gravitate to them and they'll get more of those people than they can afford. That's called adverse selection. And so it's this really bizarre thing where they're not trying to make their customers happy. They don't want them to be happy. They actually want them to go somewhere else.
Well, I guess it's where do we go from here? Are we just stuck in this insurance loop of bad incentives?
Well, I think there's like a lot of problems. There's a number of ways to solve the problem. The first thing, it's like anything else. It's like admitting you have a problem. We've got to, and you guys are doing a great job of shedding a light to here's the problem. And that at the end of this problem, there's a real patient like yourself who's dealing with a lifelong condition, who's trying to have as high a quality life as possible, whose physicians are dedicated to do that. And why should you have to fight these fights all the time? So it's shedding light on it. And then we can start to explore what are the best solutions. One solution is universal healthcare. Another solution, if that doesn't seem to be a viable option, is to either curtail or get rid of or change the way payers can do this. One of the things I've advocated is every time there is a prior auth review or a denial or this isn't medically necessary, I think that should be reviewed and signed off by a doctor. And this is the important part, state and federal law should call that act the act of practicing medicine. Once you do that, the game changes. Because then what would happen is if I'm a medical director for an insurance company and I have to sign off on saying you can't have that drug, I've got to be practicing within my field or specialty. I can't practice outside of my field. I have to be licensed in the state I'm working. I have to create a medical record that shows that I reviewed your personal clinical situation. And the big one is, and if I'm wrong and I've done damage to you, which your physician, if they prescribe the wrong medication or whatever, faces this, I should be held responsible both for my license and for malpractice. Once you do that, it changes the game because then they can't do this just blanket denial, these blanket step therapies or these blanket prior auth things. And so there's a number of fixes. We got to realize we have a problem and then start to pursue the solution.
I think you nailed it right there. I hear from a lot of patients in our community that they're just so frustrated that some seemingly random person in insurance gets to deny their medication and they haven't gone through med school or seen them or their doctor has.
Yeah. I mean, there was a story that ProPublica did about Cigna. These doctors were signing off on denials, and they were signing off on a denial every 1.2 seconds. Now, you would never accept that if your physician said, look, I'm going to write you a prescription after reviewing your chart for a whole 1.2 seconds, and your physician would never do that. Then why does a physician on the payer side get to do that? Basically tell you can't have something. Obviously, they're not looking at your clinical situation or presentation. They're just hitting a click button and somebody else is recommending it, usually a nurse. And usually that nurse hasn't reviewed your situation very much. So that's frustrating for the patient. It should be. And that, to me, in my opinion, just my opinion, should be illegal.
My opinion, too. It's ridiculous. So our advocacy network advocates a lot for laws, at the state and federal level that offer step therapy protections or ban copay accumulators and non-medical switching, things like that. What's your opinion on these laws? Do you think they're making a difference?
I think they are. It's one of those things where, and I see the successes in those laws, it's not nearly fast enough, but it's helpful. We just need to speed it up and make it more universal or more sticking of it, if you will. The problem is the payer lobby is enormous and powerful. And so anytime you try to pursue one of these advancements in the law at a state level or a federal level, you're met with massive pushback by the payers. And what they say, and they've got the spin really good, is, well, if we do this, healthcare will become unaffordable. Well, that's not really true. And sometimes their numbers are questionable at best. But we've got to play that game. We've got to continue to play it, the efforts of your organization, and we just have to keep pushing until we get everywhere we need to be.
Yeah, absolutely. And it can be frustrating at times because policy change does take so long, right? Especially at the federal level. And it's years and years of bringing patient groups and provider groups forward to say exactly what you're saying. This is leading to a lot of burnout and suboptimal care for patients.
That's one of the reasons why I like this idea of, because it's fairly simple to explain, of, hey, if they're going to sign off it, then make it be the act of practicing medicine. That's all I'm asking, is for that doctor to have the same responsibility than the doctor who wrote the prescription or who offered the care. That's fairly easy to understand and would be fundamental in the change. Now, the payers are going to hate it because it'll impact their profits. But the other thing we need to shine a light on is the payer profits have been enormous, just enormous. If you took $100,000 20 years ago and invested it, and I'll just pick one because I know the numbers on United Healthcare. Today, do you know how much money you would have from that investment? $9 million. 20 years ago, United Healthcare stock was trading at 20 some bucks a share. Today, it's about $450. And it's split 3 times. So anytime a payer talks about healthcare being unaffordable if we do this, or will this, I have a hard time with that message because you guys have been making massive amounts of profit. Now, if you have that stock in your retirement account, good for you. You benefited. But that profit has come at the expense of physicians and patients. And that's the problem I have with it.
Exactly. So maybe to leave us on a hopeful note, you can share some advice for patients and physicians who are currently dealing with this process and feeling frustrated.
Yeah, I guess a couple of things. First of all, I continue to be amazed at the passion and the commitment that physicians have. And I respect that immensely. We are so lucky to have these individuals in our system and the resiliency of patients. And that's fantastic. The hopeful note for them is there's a lot of positive things. The advances in medicine, the science, the new medications, some of the things that are coming out. There's new drugs coming out for Alzheimer's that look like they may start to reverse the progression of disease. That's incredible. The advice is don't quit. keep pushing, both for your individual well-being, keep the same for the doctor, as well as these policy changes. Make sure you get active with your representatives. Make sure they understand it's much harder to say no to some of these advances when you can put a face to a disease and a condition, like yours, like all the people that are dealing with similar conditions. So there's a wonderful Winston Churchill quote that I love that he said during the middle of the Battle of Britain, which he said, "When you're going through hell, don't stop." And that's what I told you is I know it's hard, but we've got to get to the goal line here, and so don't stop.
Thank you. I love that messaging. It was great having you on, Ron. Take care.
Thank you, and keep up the great work.
Well, Zoe, that was a really great discussion with Ron. As Ron said, there is such a huge burden on our healthcare providers to submit appeals and battle with insurance companies, and it's unfortunate that this impacts patient care.
100%. It was really powerful to hear Ron's story about what motivated him to change from working to insurance companies to, helping doctors advocate against these practices.
Well, we hope that you learned something too. And before we go, we want to encourage everyone to check out all of our podcasts at ghlf.org/listen.
Well, everyone, thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you like this episode, give us a rating, write a review, and hit that subscribe button wherever you listen. I'm Zoe Rothblatt.
I'm Stephen Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.